The psychedelic drug psilocybin, the cure to depression by Trent Rong. First, I'm going to talk about the main points. First, I'll give an introduction of psilocybin. Second, we'll talk about the names and definitions. Third, I'll tell you about the significance of psilocybin and why it should be allowed. And finally, we'll conclude. Now, time for the introduction. The compound psilocybin is a drug that can make you hallucinate and is abused by many adolescents and young adults. On the street, they are called shrooms, but in the world of science, they are psilocybin and its base form, psilocin. Introduction. A couple of months ago, on July 5th, Yale researchers found that one dose of psilocybin given to mice causes an immediate reaction and long-term growth in the connection of neurons. The finding was later published in the journal Neuron, published weekly by Cell Press. Previous laboratory experiments had shown promise that psilocybin, as well as the anesthetic ketamine, can decrease depression. Chronic stress and depression are known to reduce the number of these neuronal connections. According to the National Health Institute of Mental Health, more than 17 million people in the US and 300 million people worldwide have experienced major depression. Depression is becoming a more and more common illness across the globe, and it's up to us to stop it. In 2016, Johns Hopkins medicine researchers first reported that treatment with psilocybin under psychologically supported conditions significantly relieved existential anxiety and depression in people with a life-threatening cancer diagnosis. Names and definitions. The mushrooms containing psilocybin are abused by being ingested orally through the mouth. By definition, psilocybin is a hallucinogenic alkaloid found in some toadstools. It can be found naturally in some plants and can be synthesized in laboratory. Most hallucinogens are abused as recreational drugs. Definition. When ingested, it triggers many changes in the brain's activity, including the visual cortex, leading to changes in perception. This affects your ability to understand, recognize, and remember visual stimuli. Depression is feelings of severe despondency or dejection. Despondency is a state of low spirits or loss of hope. The hallucinations experienced can be visual or auditory, generally resulting in some noises combining, creating an overwhelming waterfall of sounds. Did you know that some people mix psilocybin into tea or other drinks to reduce the tea's bitterness? Although visual hallucinations can change between users, it's common that it can be hard for your eyes or brain to focus on certain details or grasp a concept, sort of leaving you speechless and or dumbfounded. Significance. The reason psilocybin is so significant compared to other antidepressants is that it starts working much faster. It outperforms the average common prescription. In a small study from researchers with Johns Hopkins Medical report that 2 doses of the psychedelic substance psilocybin given with the supportive psychotherapy produced rapid and large reductions in depressive symptoms, with most participants showing improvement and half of study participants achieving remission through the 4-week follow-up. Remission in depression is when a patient is no longer able to be diagnosed as depressed. Patients at Johns Hopkins Medical went through 2 5-hour controlled and guided sessions each ranging anywhere from 2 to 8 weeks apart. To be more specific about the 5-hour-long treatments, they had patients lay down and wear eye shades with headphones on. In the same group of studies from Johns Hopkins Medical, results show decreasing depression in all patients except the delayed groups. The delayed groups were the groups that had to wait anywhere from 5 to 8 weeks for a follow-up treatment. All participants were given the Grid Hamilton Depression Rating Scale, a standard depression assessment tool, upon enrollment and once after their follow-up and completion of their treatment. On the scale, a score of 24 or more indicates severe depression, 17 to 23 is moderate depression, 8 to 16 is mild depression, and 7 or less is no depression. At enrollment, participants had an average depression scale rating of 23, which is very high, but 1 week and 4 weeks after treatment, they had an average depression scale of only 8. After treatment, most participants showed a substantial decrease in their symptoms, and almost half were in remission from depression at follow-up. Analysis. Out of 24 patients, 54% were considered in remission, meaning they are no longer depressed. 67% showed a reduction in depression of at least 50% at the 1 week follow-up and 71% at the 4 week follow-up. Participants in the delayed group didn't show decreases in their symptoms before receiving their psilocybin treatment. Even with varying types of depression, the drug psilocybin was able to drastically reduce most patients' depression. Conclusion. To conclude, psilocybin is a drug that can make you hallucinate. After a certain time of being exposed to it, it can reduce stress and depression, and this is just the beginning of its use. It has also been proven to decrease extreme stress in cancer patients. If approved, this drug would take away money from all other antidepressants because it's not only better, but it's natural, and it works faster. This drug has been around since the 1950s and still to this day is not approved by the FDA as a medical treatment. This to me is just insane. The FDA has no problem approving some chemicals, but they still haven't approved a naturally occurring drug that could change the lives of millions. The problem. The only problem is the pharmaceutical industry. They won't want this new natural drug taking over, although what they could do is make psilocybin the gold standard for the rest of the antidepressants and implement new facilities to have this administered properly and make the world less depressed. Thank you. Do you have any questions? Make sure to ask them in the discussion.